got quite a shock the other day in clinic. A patient came in who I've managed for a long time, and she'd been progressively getting more short of breath, and she was quite worried. She came in for a routine review and her echo, and what I found was that she was breathless to look at. She looked kind of blue around the cheeks, around the nose, around the lips, and this was not like her at all. And in fact, when we did her echo, we found fluid around the heart. There shouldn't be any fluid contained within the sac that holds the heart and the heart itself. And I'll show you what this looks like. Here is the heart and the chambers, and here is the lining that should be right next to the heart wall. But instead there's this black area around the heart, and that is representing fluid. Now, that fluid is what we call a pericardial effusion, and it shouldn't be there. And it can even squash the heart and cause the chambers not to operate effectively, and that then affects the heart's ability to pump out the blood to the rest of the body. If it is compressing the heart, then it needs to be dealt with urgently, and we need to remove that fluid, usually by passing a fine needle into that sac and withdrawing the fluid, but that's all done in hospital as a proper procedure. In this instance, we opted to treat her a little more conservatively, given all the circumstances, aggressively diurese her, which means give her tablets that will make her pass out a lot of extra water, and then review that fluid around the heart sac. I've seen her already in follow-up, and she's doing much better. And we had the luxury of time because her heart, even though the fluid was quite a lot, wasn't being compressed in a dangerous way. So we had a little bit of opportunity to act before having to resort to taking the fluid out directly by a procedure.